Welcome. My name is Dr. Vicky Cleek and I'm a consultant psychiatrist with a special interest in adult ADHD. And today we're going to talk about the impact of the family you're born into on you and your ADHD. When I see a new patient who has come for an ADHD assessment, I always take a history which includes asking them about their family and their background. And the reason I do that is because most people don't realise that the family you're born into has a massive impact on A, whether you get ADHD, but also B, how you cope with the ADHD and when and where it might show up in your life. In this video, you'll get a flavour of why that might be. I hope it's helpful. As with all my videos, you can download my free Woman's Guide to ADHD Mastery booklet, which is available on my website www.drvickycleek.co.uk, and that will help you to reflect on your experiences in the past and perhaps help you come to terms with a new diagnosis of ADHD, or help you consider whether going for a diagnosis or an assessment for ADHD is going to be worth your while. So let's get into it together. No single cause has been found for ADHD, but we know there are a number of things which contribute to an increased risk of you having it. That includes the genes you're born with, a number of biologically mediated risk factors, including your birth weight, exposure to toxins, and also a number of psychosocial risk factors, environmental factors as well. It's important to know that exposure to a risk factor does not necessarily mean that you develop the disorder. ADHD, however, is clearly highly inheritable. When I take histories from patients, nearly always there is evidence, even if the parents have not been diagnosed previously, there is lots of red flags that one or other of the parents has or may have ADHD themselves. The risk of having ADHD, if one of your parents has ADHD, is about 79%, with higher rates in identical versus non-identical twins and children of parents with ADHD versus children of parents without ADHD. We also know that you're more likely to have ADHD if you have one or other of the neurodevelopmental disorders, including dyslexia, dyspraxia, dyscalculia, and problems with being on the autistic spectrum disorder. So often as a child, a person with ADHD may have had problems with their reading, spelling, writing, or excessive clumsiness. Smoking and drinking in pregnancy has also been associated with ADHD, as has drug use. Of course, these are more common in mums who have ADHD themselves, which may account for this. Low birth weight has also been linked and associated with ADHD, but again, low birth weight is also linked to many negative health behaviours that we see in those who have ADHD, such as not turning up to prenatal checks with the midwife. So if your mum had ADHD themselves, then they may have not looked after themselves or you during pregnancy than someone who didn't have ADHD with less monitoring. We also know that there are a number of environmental risk factors for developing ADHD, and exposure to pesticides, lead and PCBs, which we know can cause are carcinogenic with increased risk of cancer, can also increase the risk of ADHD. There's probably somewhat of a dose-response effect. For example, with lead exposure, high exposure to high levels of lead can give similar impairments to that found in ADHD, with executive functions of attention and cognitive flexibility, as well as alertness being affected. Currently, there isn't actually any convincing evidence that diet plays a major factor in the development of ADHD, and that includes exposure to sugar, artificial food colourings, low levels of zinc, iron, magnesium and omega-3 fatty acids. However, if you have a poor diet, it's not beyond the realms of possibilities that these will have an impact on you physically and mentally. And adverse social and family environments such as low parental education, lower social class, poverty, bullying, peer victimisation, negative parenting and maltreatment, as well as childhood sexual abuse, are all associated with ADHD symptoms. There was a classic study looking at orphans in Romania who had little contact with anyone else and were left in cots for extended period of time without any stimulation whatsoever, and they had high levels of inattention and poor concentration when the children were tested. If you have a parent with ADHD, you're often going to be exposed to inconsistent parenting because their lack of attention, inability to stick with routine can lead to this. Shouting is often more common in families with ADHD because of that emotional dysregulation and difficulty in managing emotions, as well as general frustrations, including waiting for things. There's also a higher incidence of mental health problems in parents who've got ADHD. If you've had ADHD undiagnosed and untreated, you're more likely to have anxiety and depression. ADHD also can lead to financial stress. So you may have been born into a family where your parent either gambled or made impulse purchases and didn't manage their money particularly well. It's also more common to move around a lot, either parents moving house and thus schools or jobs, again as a consequence of ADHD, and that general sort of family chaos. And then of course there's the response of the parent to the child with ADHD, which can lead to them becoming very over-controlling or judgmental, giving them labels such as you're lazy or you don't care, or alternatively they can be very supportive and make a number of accommodations which can be really helpful for them. So what did all of this mean for you when you were growing up? Were you a child in a family where there was a divorce? Were you subject to multiple moves with changes of school because your parents had moved house multiple times, or jobs? Were you witness to financial pressures as a consequence? Family addiction, anxiety, depression, inconsistent parenting and unpredictability? And were you in the midst of arguments, and how did you respond to that? If you've got a parent with ADHD with particularly difficulties in paying attention, you may not have felt listened to, and you also might have felt that your lives were extremely busy with no downtime for yourself. So in summary, the environment you're born into and the genes you're given will have had a massive impact on your view of the world and your self-construct, and consequently on your behaviour. And this will have then had an impact back on your parents and caregivers and family group in a kind of feedback loop. Now it might be a good time to take a breather to reflect on how any of these issues we've discussed relate to you and your experience of growing up and your family. Did you have a parent with ADHD difficulties? If so, what was your parents' response to your ADHD? And what impact did that have on you? And you may want to go back to the workbook, and there's a space in there for you to make some notes and reflections to build up a picture and help you again disentangle what's you, what's your ADHD, and also what's the ADHD impact on from your family and the environment you grew up in. So I hope you found this video about ADHD and family helpful, and I look forward to seeing you at the next video. Bye.